Okay, I think we'll probably make a start. My name is Nabila Farah. I'm one of the fellows at Hughes Hall, and I'd like to welcome you to this event. Before we go any further, I'd just like to let you know that we're recording all the proceedings this evening, so I hope that is acceptable to everyone, because we want to try and capture as much of the input as we can that may be useful for further discussions. This event is occurring under the auspices of the Bridge and is under the banner of the Global Health theme in Hughes Hall, which is a theme that is promoting a series of events that is focusing on the socio-economic and political determinants of health in a broad context. Perhaps I could say just a word or two about the Bridge. This is an initiative that Hughes Hall has started to facilitate the development of translational research by aiding researchers to make connections with industry, with professional organizations, and with government. And the idea here is to see if one can translate basic research into products, processes, or the development of policy that would be useful to society. So tonight's event is the fourth in a series we've had in the Michaelmas term that has come under the general title of looking at the way in which the pandemic has impacted our thinking and practice as we begin to adjust to new realities that we've been confronted with. The first event looked at the impact on healthcare systems, the people and the patients, and the lessons for new learning. The second event looked at infrastructure, the impact of the pandemic on infrastructure, on cities, city design, on transport, on patterns, changing patterns of working, and how we might think about how services are delivered in the future. For example, such as medical services. The third event looked at the legal, ethical, and philosophical issues that the pandemic has thrown up, given the sort of emergency legislations and changes in our living practices that have been forced upon us by government and the pandemic. This event this evening is the fourth in the series, and it's going to be looking at, in a cross-disciplinary fashion, at the impact of the pandemic on knowledge, on skills, and on health. The session will be moderated by Deborah Spindleman, who is a research student at the Faculty of Education and is currently researching the impact of stunting and cognitive impairment on unmet learning needs among early grade students. So without further delay, I'll hand over to Debbie, who's going to act as the compere for the evening. Over to you, Debbie.
Thank you, Nabil. I want to thank you so much, everyone, for joining us. And today, our lead speakers are all senior fellows at Hughes Hall. We're joined by Professor Tamsin Ford from the Department of Psychiatry, Dr. Carolyn Trotter from Cambridge Infectious Diseases, Professor Paul Tracy, the Judge Business School, and Professor Ricardo Sabates, whose room just became dark, from the Faculty of Education. Excellent. So to kick things off, our first question is going to be aimed for, initially at least for Tamsin. What have been the major impacts of COVID-19 in terms of knowledge or skill formation, as well as health in your field?
Thank you. So my background is child and adolescent psychiatry, so I'm much more comfortable with the health end. So I'll start with the knowledge and skills, feeling slightly nervous because I know there are a lot of people in the room who know much more about that than I do. Now, medicine, which you study if you're going to be a psychiatrist, that's the main difference between psychiatry and psychology, is an apprenticeship, at least in the latter years of training. And it depends on patient contact, but it's difficult to have inexperienced people around at a time of high emergency when people are very stressed and having to work, above and beyond normal capacity. So actually what happened in our medical school at Cambridge and across the country is a kind of divergence with the senior students who would have qualified in the summer. So this hit in March. Basically, their qualification was accelerated and they all most of them, nearly all of them, started working on the wards as doctors 3 or 4 months earlier than they would do. Which for some, I imagine, was pretty daunting, but they wouldn't have been passed unless, they were good enough. For the more junior clinical students, it was a little bit disastrous because they missed a chunk of training and there was a big scramble, which I'm sure was reflected all over the university in trying to get training online. There were some benefits to that. The attendance at seminars and lectures shot up as it did amongst practitioners, so continuing professional development, I think, because it's hard enough to find an hour in a busy clinical day. If you then have to add on the half an hour travelling time and they're trying to find somewhere to park and they're not having any lunch because you've run out of time, you can see why, when it's a matter of clicking a link on a computer, that actually more people get to lectures. However, for those skills that you can't learn surgery by attending a seminar, you actually have to be there in the operating theatre. And I'm sure that there are many other similar jobs. I had a conversation with a friend of mine who is a barrister who, like me, is very worried about the very junior people just starting out on their careers who do a lot of learning by just being around. So, we have done very well. My department is essentially running remotely for those of us whose research isn't about testing people face to face or doing, complicated scans on them. There's lots that I do that I can either interview people remotely or send them questionnaires by email, and I can sit and analyze them at my computer. But what my groups are missing out on is that kind of informal coffee room, corridor conversation, and the things that you learn up just, if you have a Zoom meeting, everyone arrives at the same time, and those little sort of conversations that happen on the edge of it, which actually are a really strong source of implicit learning and skill building, just aren't happening. And I, for the life of me, can't think how we replace them. So clues as to how to do that desperately sought, please. And then, of course, I am a child psychiatrist, so part of my job has been worrying hugely about the absence of children in our current policy and our response. I think it's very, very telling about our society, and not in a very good way, that we opened pubs and restaurants before we opened schools. There is a lot of evidence that time out of school has an adverse effect on children's academic attainment, but also their social skills. In the teenage years, peer influence is enormously important, but actually it's also important to social development amongst younger children who perhaps have fewer options to draw on. The other big worry is the amplification of inequalities. So some really interesting research, which I can give people a reference for if you're interested, in Glasgow. They interviewed families and practitioners working with families at the beginning of lockdown in April and May, and they found really high levels of anxiety, particularly about housing and job insecurity. When they went back in June or July, the families where that was sorted had fallen into a routine, were coping. The kids had, access to somewhere to study, decent Wi-Fi, they were getting on with life. And actually the families were valuing having additional time together. that's a contrast to the families where there was job insecurity, they didn't have Wi-Fi, or if they did, they had one laptop between 4 or 5 children and a parent, they lacked childcare, and we did see an uptick in domestic violence and stress on families. So, you know, the education and health and skills deficits are diverging in different groups, and we're going to see increased health and increased education inequalities unless we think very carefully about how we're going to deal with them. Now, coming back to health, you will have heard a lot about, you know, the physical effects of COVID and the mortality rate, but we also have long COVID. So some people seem to have symptoms for months afterwards that we don't really understand. So even if you do survive, it doesn't necessarily mean you're better. There are mental health effects when you're acutely ill, there are high rates of delirium and inflammation in the brain. There are also mental health impacts of long COVID and not being able to function. And then, you know, one of the things we've seen, and it relates to knowledge and skills, is an absolute proliferation of armchair epidemiology. Now, there is a heroic systematic review being run out of McGill, where it's a living systematic review. So they're keeping it going every day. And they have 3 linked systematic reviews. Review 1 is pre-post COVID change in mental health. Review 2 is factors influencing mental health during COVID, and that's stopped in September. And review 3 is clinical trials. Now, they have screened, as of Monday, it's the last time I checked it, they have screened 33,000 abstracts. They have 19 studies in review 1, 43 in review 2, and I think they have about 50 trials. So 33,000, more than, down to probably about 100. There is a lot of disinformation out there, and that's something else that we need to think about. And I could give you details about the impact of mental health, but I think we're having a more general conversation today. So I'll stop there and see if other panel members want to join in.
Fantastic. Thank you. Thank you, Tamsin. That was really rich. And I'm really glad that we have an opportunity in some of our later questions to keep digging into that equity piece, because I think it's really important. I'd actually like to pivot very quickly to Paul, specifically around some of what Tamsin had said about hands-on skills suffering or informal sort of networking opportunities. Is that something that you're seeing in your work as well? Oh, you were still just a bit muted.
You think I'd know that by now after being 6 months on Zoom. Yeah, I mean, I guess I'm a business school professor, so I'm sort of approaching this from the business side of things. And you know, one of the things that students really want, they want cutting edge knowledge. They want to know what's going on now. And the curriculum that we have in business schools actually isn't necessarily geared to the sorts of problems and organizational issues that people are dealing now with regard to the pandemic. So I think part of the issue is that the way that the COVID has affected business organizations is very varied. So it varies by sector, it varies by organizational size, it varies by whether you're a social enterprise or a for-profit business. And so there's a lot of diversity, and a lot of the evidence we have at the moment about you know, how business has been affected and the sort of knowledge that we need in terms of training our students is anecdotal, or it's based on survey data from consulting firms like McKinsey and so on. So we don't have a lot of knowledge. So when it comes into the classroom and trying to convey the key things that are happening, we're having to improvise a little bit. But what I thought I would just say a few things about was I suppose some of the general impacts on business and the types of knowledge that we're trying to convey to the students. So the first thing I should say is that we've got a new buzzword in the business school world, and that is the distance economy. The distance economy is you know, what you need to do to deliver products and services remotely or in a socially distanced way. And the distance economy has had a number of different effects on the way that businesses operate. I guess the most obvious is that, and this was particularly apparent in the early days of the pandemic, is that the role of digital and technology became very, very important. So people had to transform very quickly the business models of almost overnight. And so for firms that were born digital, or for firms that are new, that was obviously much easier. But for mature firms, for older firms, that was something that was actually really difficult. So this skill about how you manage that digital transformation, that became really critical. The second thing that happened early on was that because a lot of markets were disrupted, they had to change direction really, really quickly. And so a lot of ideas that we use in entrepreneurship, when we teach in entrepreneurship around pivoting and the lean startup, these ideas became a prominent part of the way that larger organizations thought as well, and talked about what they did. So there was a whole set of ideas from entrepreneurship about filling fast, filling often, and so on, that is now part of the sort of toolkit or the skill set of larger organizations. And so that's a big change in the way that I suppose we're teaching about business and management. In terms of the implications on health, I mean, obviously, as a business school professor, I wouldn't claim to be an expert on health, but there are a couple of I suppose, fairly obvious changes that have happened that affect, how we're teaching stuff in the classroom and affect organizations and business more broadly. One is, of course, that a lot of companies, a lot of organizations are working remotely. And that requires a whole new set of skills that we're not actually really very good at teaching in business schools, about the softer skills about remote working. It also has fairly significant implications for mental health and social isolation. And what we see is a lot of companies actually been really innovative and really creative in how they are dealing with occupational issues around isolation. Lots of online exercise classes, online meetups, online social events. I had a PhD student recently who had a job interview in the Netherlands, and he was sent a basket of food in the post for his interview of Dutch food that they were eating while they did it. So there's lots of innovation around occupational health that traditionally we've never really taught in the business school environment that we're having to teach. And then the final thing I'd say is there's been really interesting changes around freelancing and freelancers, the so-called gig economy. And there's lots of people who have moved into the freelancing space out of necessity. Some of them have come into the business school world. And there's lots of people who are moving in the other direction, out of freelancing, because they want the security that comes with employment. And that has created a lot of stress and anxiety for both groups, moving in either directions. And again, that's a new set of issues that we're dealing with and trying to teach in the business school context. So I guess that's the general set of issues around, I suppose, how the pandemic has affected business organizations in general, but also some of the more specific things around health and mental health.
Fantastic. Thank you, Paul. Before we move, our very next question is for Caroline with regard to equity. But before we hop into that, I just wanted to see very quickly whether Ricardo or Caroline have anything that they want to say more to, again, some of the equity piece that we're hearing, but the specifics of your international experience. There's been, as offerings have moved digital or online, that there are plenty outside of the UK that are being left behind, as well as those within the UK. Wanted to see if there was any quick notes that either of you had on that before we moved on to the broader equity conversation.
If I may, Debbie, it's a little bit for us in education. We're trying to think about what Tamsin was saying. What do we mean by knowledge? To be able to assess what exactly the pandemic is being affecting, and what do we mean by skills? A lot of the work that we're doing, that I do with colleagues who are in Hughes Hall, such as Professor Nidhi Singhal. Caroline knows also this because we work internationally in Africa. We need to think about, what exactly the pandemic is affecting, because a lot of these students are going home and they're probably learning livelihood skills they're probably learning different types of socializing skills. And the questions that we're raising is like, what is the kind of knowledge that we're trying to capture? Because clearly there's some knowledge that they're not being able to access through the schooling, but there's other knowledge that is actually happening there. I was really interesting to hear Tamsin the issues around the agency of the families and their ability to cope and deal. And this is something that just earlier on, we had a meeting with our colleagues from Rwanda to think about the ways in which teachers in Rwanda had been had used their agency and their, we need to start thinking much more positively about the trajectories and the changes that they're trying to have according and how they're trying to adjust and not see them as a deficit. So which is something that I can touch later, but then I'll just stop there to put a few thoughts.
Before you letting you hop in there, Caroline, I think it would be a great chance to sort of build on that and then also dive right into your question, which is, what are the main equity issues raised by COVID-19 within your area of research?
Thanks, Debbie. So I'm an infectious disease epidemiologist, properly qualified card-carrying epidemiologist, not an armchair one. And I work mainly on vaccine-preventable diseases, mostly actually meningitis, not coronaviruses, but my work sort of spans the UK and sub-Saharan Africa. And thinking about vaccines, I mean, one of the key elements for a successful vaccine program is that you can have high uptake and reach all those who are usually children targeted for these vaccines, reach everyone in need. For meningitis vaccines, actually demand is typically very high and consequently uptake is high. And this was seen particularly in mass campaigns that were conducted in the African meningitis belt, which targeted individuals aged 1 to 29-year-olds with a vaccine called Menafribac. And Burkina Faso immunized 10 million people in 10 days back in 2010, which is an amazing effort. And administrative coverage was over 100%. Fantastic public health story. To maintain that protection with this meningitis vaccine, it's now given to babies and toddlers. But we know that during the pandemic, immunization coverage has fallen, both in the UK and around the world, in many African countries. So children have missed out on receiving some of their vaccines. And I think this really very clearly raises equity issues. It means the distribution of vaccines has been unequal over time, and more so when you consider that the drops in immunization uptake are more likely to have affected children living in areas with more fragile health systems. I mean, there is of course an opportunity to catch up and recover these losses later. Maybe I'll say a bit more about this later, but that's a key equity issue is that we know that some children have missed out, and we don't want to slide back on the massive gains actually that have been made in global immunization. Another key issue within the vaccine world, and this isn't something I'm personally involved in at all, but it's especially pertinent now that it looks like we've got 3 vaccines that actually work, is how can we ensure fair global access to COVID vaccines? So this is a massive issue, but it's really, really good to see the creation of COVAX, this initiative led by the World Health Organization, Gavi, the Vaccine Alliance, and the coalition, CEPI, the Coalition for Epidemic Preparedness and Innovation. And they're really trying to bring countries around the world together to ensure that there is fair access to these new vaccines. Aiming to use a variety of tools, including advanced market access, getting people to pay for vaccines in advance, guaranteeing that everyone have 20% of their needs funded through this process, with the aim of providing 2 billion doses by the end of 2021. So it's really good to see these big global powerful organizations coming together to examine this issue of equity and to do something about it. And I like their tagline, which is no one is safe until everyone is safe. So really trying to push the importance of equity in COVID response.
Fantastic, thank you. We want to turn it over just real quick to Ricardo to see if you'd like to speak anywhere else on this, particularly I think what Caroline just said about the value of collaboration and working across borders, across sectors, across sort of silos. Are there ways that that's showing up in your research with regard to equity, Ricardo?
Yeah, thank you, Debbie. And yeah, with respect to our research, especially we're working in mostly low-income countries with already marginalized and disadvantaged populations. And I think what basically happened to us in education is that the schools closed. And we can think that immediately we started to think about the markers of disadvantage that they were all there. And there's a lot of writing. I think the community started to really raise the awareness of the markers of disadvantage that they were already there. They were not the result of the pandemic, but the exacerbation of the pandemic would have mean that these populations would have been at risk. And I can name many of the ones, such as girls, refugees population, those with disabilities, low income, low performance, and the list kept going and going and going. And I think what really started to be very important and prominent for us was not only to understand the disadvantages of the population, but we started to understand the structures in which they exist. And because it's what is really going to exacerbate these inequalities. We saw a lot of system support. And sorry, I know that I'm kind of getting into the system, but there are a lot of the system started to react and to try to provide support with television, with radio, but in a system of structural inequalities and differences, then some of the children in their homes, they didn't have access to these resources to be able to have the materials that they deserve. And I think what is really now at the core of what we're trying to understand is the process. So there are really interesting processes that were happening in the home for learning to be taking place. And I'm just going to basically just briefly give you the example of ASER 2020. ASER is one of the largest surveys on households in rural India. It's done by the ASER Center, which is the arm of Pratham, the largest NGO in India. They're just fantastic. They use community to carry out their assessments. They have many years doing it, and they did a phone survey. And they found that close to 3/4 of children, these are children in rural India, were receiving support from a family member. Younger children were receiving more support from older children. There was that dynamic. And then as children, younger children in general receive more support from family members, but the older children were receiving more support from siblings that were ahead of them. And it's interesting because only 1/3 of them received materials from the school. So here you have, but there's definitely learning happening. There's definitely, the household is absolutely using their resources, their decision-making to make learning take place. They're not just passively thinking, oh my goodness, this is a terrible situation. They are very agentic in trying to make this learning happen. So, obviously it's very difficult because the pandemic is putting us this black box, this inability to be able to listen for more the voices of these households in terms of how this learning is taking place. So I'll stop there, Debbie, and back to you.
Thank you. Tamsin, over to you.
Just to build on that, I think I'm obviously much more aware of what's going on in this country and with a kind of mental health lens. So there are lots of reasons that poor mental health feeds into problems with learning and concentrating and focusing and coping with school, that then in its turn can bounce back on and cause mental health to deteriorate. And I think there are a couple of quite stark inequalities. So there's data from several thousand patients attending the Maudsley Hospital that colleagues collected in a survey. And what they found was where the child was doing badly, that they just, even if there was support from the school, they were really struggling to engage. And often these are families that are very vulnerable. And we found the same in a national survey that had pre-COVID data. The other thing is that there was a dismantling of protective safeguards in social services, and a structure that kept vulnerable children on people's radars all completely went away. And for families relying on respite support or access to particular structures, suddenly that's not there. And that really knocked some of them, particularly those on the autism spectrum, where change is difficult. Even minor changes are difficult. That said, there was really interesting data from a very clever PhD student from Bristol, part of the School for Public Health. Her PhD had involved getting data from about 1,000 13 and 14-year-olds around the West Country in 3 or 4 schools, I think, in October. So she had these mental health data on a sample, and she managed to get back into the schools, or at least get access to the pupils, and got data on most of them. In fact, she got a better response rate second time round in kind of April, May, maybe because people were sitting at home and they were bored. Now, overall, her sample didn't show a deterioration in mental health. However, if you split the sample by those that were struggling, either with anxiety or with depression or with poor well-being, their mental health improved, which I think is probably an indictment of their everyday life and says something about us needing to think about the pressure that we put on children in schools. And I think just one last thing I'll say about equities, the mortality rate amongst the excess mortality rate amongst those with severe mental illness. We've known for a long time, if you have a severe mental illness, your life expectancy is reduced by somewhere in the order of 15 to 20 years. And we've seen that in the pandemic. So for people without a mental health condition, the mortality rate starts shooting up from COVID after the age of 70. But for those with a severe mental illness, on our local books, and this is a paper coming out of Cambridge University and Cambridge and Peterborough Foundation Trust, for those with a severe mental health condition, it starts escalating up, mortality escalates in the late 50s. So not only is, your life expectancy reduced, but when there's a risk, those risks, and I think it's stacking of risk factors, which is, we're talking about systemic problems again. And I'll stop there.
Thank you, Tamsin. And as on a personal level, as someone whose family was kept afloat for many years with respite services, I hadn't thought about how that would affect it. And that's a really powerful example. Thank you so much. We've been talking quite a bit about sort of systems and wanted to take it over back to Paul to hear from you a little bit more about how the system in which your work is embedded has responded to the COVID-19 crisis to minimize the impacts of the pandemic on knowledge, skills, or health.
Good, thank you, Debbie. Yeah, so I was going to I thought about this question in 2 different parts. So the first part is really this sort of immediate system or environment that I work in, which is supporting social entrepreneurs. And, we have a social enterprise incubator in the centre that I run, the Cambridge Centre for Social Innovation. It's called Cambridge Social Ventures. And they support a lot of social entrepreneurs. Part of that is a workspace where people are coming together for training and so on, and part of it is the skills and the trainings and that they get. Now all of that, of course, has had to move online, but that can be done. The more difficult part is really how do you support the social entrepreneurs? Because if you're a social entrepreneur operating at this time, it's very difficult for you. And so some social entrepreneurs have seen their revenues and their business models fade away really, really quickly. But for others, of course, it's created lots of opportunity because with social problems become opportunities for social entrepreneurs. So there's also been a sense in which for the people who are supporting, people like myself and the team at Cambridge Social Ventures who are supporting social entrepreneurs, that creates an additional challenge. But it's been quite amazing to think what the team has been able to do in order to help them and to make sure that they're able to grow and take advantage of the opportunities. I just had a couple of examples of the ventures that we're helping to give you a sense in which how the current situation can sometimes create opportunities for for social entrepreneurs. So one is a social enterprise called Cracked It. So it's a smartphone repair service staffed by ex-offenders. And obviously when lockdown came and lots of people were relying much more on technology, there was a huge surge in demand for people who were wanting their phones fixed, their computers fixed. This is a business employing ex-offenders in mobile units, moving them around to workplaces in residential areas. And so that grew really, really quickly, and the team was able to put together a way of supporting them to help them do that. The second example I wanted to tell you about has a health angle. It's a digital social enterprise called Elemental Software, and it's a social prescribing platform. So it allows healthcare professionals to refer patients to non-clinical services. So it could be, it could be book clubs or walking clubs or anything that sort of helps support their needs around mental health and community and so on. Again, that's another venture that, in the context of COVID, has had huge growth opportunities, and so we're able to come together to help them. So there's lots of examples like that where we were able to offer support to social entrepreneurs that had this tremendous opportunity created by the pandemic, while at the same time helping those other ones that had their revenues cut really, really quickly. So that's the sort of immediate day-to-day system, if you like, that I operate in. But if you want to sort of zoom out a little bit and thinking about business schools more broadly, I think it's really interesting to see what has happened. So a lot of people expected they would be in trouble, that the student numbers, MBA numbers in particular, would collapse. In fact, the opposite has happened. So numbers have grown quite significantly. That's surprised a lot of people, but I think it also puts a lot of responsibility on us as business schools, especially in the MBA program, to think about the sorts of people, the sorts of training that we're giving people and the sorts of skills that we're giving people, because in many ways the sort of business school model is not necessarily fit for the situation that we're in. So this has led to a lot of soul searching, I think, within business schools about a number of different issues, and you can see the change happening. You can see the conversations at the Judge of Business School happening right now about this. I mean, for example, with regard to digital technology and digital innovation, which is such an important aspect of this pandemic, so much of this stuff is taught on the side, little courses in digital innovation, technology management. That is in the past. Digital is everything. We should be infusing that through all the core courses. We have to do that. And we're moving quickly in that direction, but not fast enough. The other thing, of course, is around stakeholder capitalism, the role of social responsibility. This is something, of course, that I've been really passionate for a very long time. But even though this is a topic that people have been talking about for many, many years, again, we're still in a situation where, okay, we have an elective course in CSR, we have an elective course in social enterprise. It shouldn't be like that. I created a master's program in social innovation a few years ago. I would much rather not have to run that program, because everyone was teaching social innovation throughout. So I think that on the plus side, there's a whole new generation of students coming through and junior faculty coming through who understand all these issues intuitively, especially around the social dimensions of business. And so I think that's really positive. One final point I'd make is that one of the ways that business schools are measured and ranked is through these different, like the FT rankings, the Business Week rankings. Now, these rankings are predominantly salary-based rankings, so they basically measure how much your students earn after a particular point in time. And I think that that is completely inappropriate. It's been inappropriate for many, many years. And I think that the current situation has really made many people in the sector reflect, what are we actually doing? How are we measuring our students' success on their salary 3 years out of the program? That is just crazy. And so I think that there's been a lot of people who are reflecting on what we do, maybe the responsibility that we have, because there's so many people who are coming to us and looking for how they can move forward from this situation.
Fantastic. So those are some huge system changes. Thank you. Also excited to hear about your example about ex-offenders or prison reentry in terms of, you know, thinking creatively right now to assess an existing challenge and leaning into that now. Thank you so much. I wanted to see Caroline coming in a very different space. How are you seeing these system responses to, particularly in vaccinations, in trying to address these challenges in your work?
Yeah, I think the similarities with what Paul was saying is that a really positive response, really. And I think the existing systems were used and people pivoted quickly to try and address, you know, the COVID impact. So I'm going to give two examples. One is sort of with my research hat on, looking at the potential impact of COVID on falling immunisation rates. So I'm a member of a vaccine impact modelling consortium, which is about 20 different modelling groups around the world convened by Imperial College. And the aim of this consortium is to measure the impact of all the vaccines that are funded by Gavi, the Vaccine Alliance. So 10 different vaccine antigens and 2 modelling groups per antigen. And we sort of try and assess the benefits of vaccination in terms of cases averted, deaths prevented. So I mentioned that my research looked at Menafrivax, meningitis vaccine. And so Gavi, UNICEF, the Gates Foundation and World Health Organization were interested in saying, well, okay, well, if immunisation rates fall and these sort of supplementary immunisation campaigns stop, what's going to happen to these other diseases? What problems are we storing up for the future, or what are the immediate issues? So other groups modelled measles and yellow fever, and we looked at meningitis. And actually for meningitis, because previous campaigns have been so successful, it's not creating big problems if routine immunisation falls in the short term, or if some campaigns are delayed. So it was sort of good news story for meningitis. But on the other hand, for measles, the situation was sort of much more dangerous. It has a much higher R number. Everyone knows what the R number is now. Measles is much more transmissible. So I think this work sort of helped activities to be prioritised. So this was fed back to the countries and ministries of health and helped different activities to sort of be ordered in terms of the effect on health. And then the second example is where my different hat. So I'm the academic director of Cambridge Africa, which is a university programme that supports African researchers and promotes sort of mutually beneficial collaborations and equitable partnerships between Cambridge and Africa. And we have every year, every autumn, a small grants round where we give up to £20,000 to pairs of researchers from Cambridge and Africa to sort of provide some seed funding to spark off new projects or run workshops. And we're able to gather up unspent funds from previous years and offer this in a special sort of COVID-19 emergency round from April onwards. Again, to get pairs of researchers in Cambridge and Africa working on a problem that would have a sort of immediate impact on COVID or understanding of COVID. So we have 15 projects over a really diverse range of topics, projects in education around COVID impacts in school reopening in Ethiopia, the effect on disabled children in Malawi. We provided funds for PCR machines to be sent to Madagascar and DRC to improve testing capacity, and provided 3D printers to make masks in Malawi, which there's a fantastic story about that on the university website. So just a whole range of different projects, and just the response from African researchers and their collaborators in Cambridge was really fantastic. So people worked really quickly to use their skills to something that would make a difference. And I think that again, it was great to see that, you know, people working where they identified this critical need.
Fantastic, thank you. I think that sort of brings it together nicely for our last question, which is just about sort of key directions for research moving forward, in terms of not just making systems more resilient to global health challenges, but, you know, what are the strategies and areas of research we should be moving in? And this question starts out with Ricardo, but I'm sure we'll all have a piece to add.
Thank you. I think in the area that I'm working in education, the first question that we're asking ourselves are, what are going to be the pathways that can enable those that will drop out from the system, because it is expected that there will be many children who will drop out from the system, to enable learning opportunities over the life course. And here I think that we will will encourage us to move to think much more broadly about the different learning opportunities that students and young people can have. In Hughes Hall, we have a fantastic, one of our Hughes Hall students, an absolute incredible learning career, completely out of your traditional A-level or level university or high school, secondary high school, and so on. And it's just fantastic that through these different pathways, he's able to join us to do neuroscience. And I think this is some of the key areas that we need to focus, because the opportunities, learning opportunities for many young people are going to be affected. The system is going to be overcrowded. Many systems in Africa are thinking about how exactly they're going to cope. Do we receive the first year students, the year one? And are we delaying the year ones? Are we allowing everybody to go through the system? And these are questions that different systems, at least we're working with 2 or 3, are thinking about how they're going to be able to put this together. The second thing that I think is an area of further research is the new dynamics that we're having in learning environments. I think, we're all saying we're learning online, but what are the dynamics of this learning online? For whom this learning online is more effective? Are we creating new barriers to learning? Are we creating new inequities because of our new learning environments? And also with social distance. So today in our engagement with our research in Rwanda, they were telling us that the girls who benefit from group work are not able to have group work in the classroom because they're now just looking forward. So already, we're creating some disadvantages that are happening in the classroom. And it would be really important to then think for how long we're going to be having this change in learning. And then what can we do to support then the learning of learners who are actually being affected? So those are just, and I think probably this is more going to Dan, since I'm really interested in the social emotional and well-being, but I will stop there because that's definitely not my area.
This gives me the perfect chance to toss it back onto Tamsin. What would you like to add to that?
Well, I think we are going to have more. There is, no doubt in my mind, as we fill the data gap, there is certainly evidence of some of our population, school-age population, having worse mental health. It seems to be mainly older teenagers who were actually not doing well before COVID hit. And then I think we have this perfect storm of disrupted education and social isolation. There's just a stacking of risk factors. So I think we are going to have to get smart. There's been a lot of resistance to taking up remote ways of working and delegating to people without expensive training. We're not going to be able to massively expand the mental health workforce we have, and we don't have enough. About 1 in 4 children with an impairing mental health condition gets to services over a 3-year period, and that's on old figures. So we are going to have to get smart. What I've seen happen, and we need to research it, is the pivot to remote working. It's run behind where it could have been, which is interesting, as parallels with what Paul said about business. And of course, it just had to, unless it was a crisis, it just had to in order to keep people safe. And actually, the early data coming out is the experience was less challenging than expected. People were able to do risk assessments and safeguarding assessments. They were able to build a rapport. And for some families and some practitioners, it seemed to work better. Now, obviously, if you're not pulling children who are vulnerable out of school to come to an appointment, that's a benefit, less time, less disruption to the family, but also to the clinician if you're visiting things. The other thing we've seen is better attendance at case meetings across agencies, which is only a good thing. So I'm anxious that we refine that, and we need to study for whom that kind of access to remote assessment works well, and when it's not appropriate. And I think we need to work with parents, with practitioners and other agencies, with young people to co-produce guidelines. There are some real areas of concern. So if you're dealing with a young person or a parent who maybe is in a coercive relationship, you have them in a box rather than the room. You do not know who's outside the camera angle. And there are real issues for confidentiality. And there's also, if you are dealing with really intimate and upsetting aspects of people's lives, they may not want it in their bedroom. You know, they may want to come and put it somewhere safe in the clinic. So it won't be a panacea by any means, but actually I'm very keen that we don't slip back to completely the old way of working, and that we take what's good forwards. Because I think it, you know, if you're not traveling between clinics, you will be able to see more people, and we're going to have to. And I'll leave it there.
Fantastic. Thank you, Tamsin. Wanted to ask Caroline and Paul, just briefly, would either of you mind touching very briefly on areas of further research for you as well?
Yeah, I mean, I think it covers both how to make systems more resilient and research is in how to, the role of international agencies that, you know, rely on cooperation, like the World Health Organization. You know, it really does run on a shoestring budget. It'd be great to have Joe Biden bring the US straight back in to WHO, but I think they do fantastic work given their budget and other limitations. You know, the Ebola 2014 West African epidemic was a wake-up call in terms of epidemic preparedness. So new organizations were created, like the CEPI, the Coalition for Epidemic Preparedness and Innovation, and that, you know, that's great. I think it hadn't got going quite enough to help us with this pandemic, but I think it's really important to build on these international structures, particularly with a lens on equity for global health. You know, global health isn't something that researchers in the global north do to people in the global south. It's supposed to be, you know, very much two-way mutual learning. So we've got to, you know, rethink about global health. And I think in terms of key research, I think it's vital to understand people's attitudes to vaccination. I think vaccination is the exit strategy, or an important exit strategy. So we've got to understand people's attitudes and maintain vaccine confidence. Thanks.
Thank you, Caroline.
Great. I mean, I think it's really interesting in the social innovation world, the business school world. I think there's finally an increasing interest in studying social problems, social issues, and a recognition that the most deep-rooted social issues and problems in the world can't be studied by any one sector or type of organization. It can't just be solved by governments. It can't just be solved by NGOs. It certainly can't just be solved by companies. It's going to require people working together, people with very different priorities, with different mindsets and ways of thinking, different sets of practices. And so at the moment in the business school world, it's really interesting to see the rise of interest in the study of grand challenges and collaboration across sectors to address these grand challenges. That's something that's quite new, although it's quite interesting, you know, just having been reading recently quite a lot of the stuff, that it still tends to be quite corporate focused. So the idea is that you have, as the backbone organization, you'd have like a multinational corporation, and then the other actors would be would play a secondary role. But I mean, that is where a lot of work is going on at the moment in my world around these structures of collaboration. Just, it's really interesting also listening to what Tamsin was saying about remote working. There's actually in a big organizational literature on remote working. Now, of course, remote working, the types of people and the types of professionals and occupations being studied are perhaps quite different, but actually some of the learnings and some of the research could actually be quite applicable to some of the points that you were making, Tamsin. So there could potentially be some areas to bring in traditional organizational research to think about issues around remote working.
Fantastic, thank you. I'm hearing some really powerful threads of, you know, collaboration across new sectors, bringing folks back into the conversation. Caroline working on me, trying to get my president to to get back in there. I hear you, girl. But also, you know, there's potential, you know, not wanting to zoom past. For whom this seems to be working. You know, there are ways that our COVID pivots are actually addressing certain forms of inequity and wanting to not just automatically go back to the way things were for whom, you know, it didn't necessarily work for everyone in the first place. So thank you so much. Now we're actually going to be breaking out into 4 breakout rooms for about 20 minutes or so to discuss further. All participants, you're welcome to join. You'll be assigned to one of the 4 breakout rooms, and we'll get to dive a little bit more deeply into the research areas and experience of each of these senior fellows. And then we'll come back again for just a couple minutes at the end to wrap up. So thank you so much, Aldebra.